I'd like you to please describe for the jury what we're viewing, and at any time, if you want me to pause the video, please just indicate, and I'll pause the video.
Glad to. Okay, so this is an overview of the administration of sedation. And the first thing you do is you have to do the preparation of the room. So at this point, Professor Hung is reviewing the anesthesia machine, checking the equipment, and going through to make sure that everything is basically properly in place. There's emergency airway equipment that must be available. That's an oral airway to pick the tongue up from the back of the throat. This right here is called a nasal airway. That goes through the nostril to the back of the throat, again, so that air can go past the tongue into the trachea. This is called a laryngoscope. Can you just pause for just one moment? Sure. And the laryngoscope is what you use in an emergency if you cannot move air into the patient. Let's continue. So here Dr. Hung is going to observe the breathing. You have to watch very closely because the diaphragm actually is not moving very much when people are sedated. And he then checks the vital signs. And I think if you just continue, I think they're labeled. Yeah, here's the electrocardiogram up here, EKG waveform. This is the pulse oximetry shown here. And finally, this nice regular pattern here is the capnometry. That's the carbon dioxide. Please stop. In this particular patient, young, athletic, the heart rate is only 41. Oxygen saturation is 97%. That means the patient's lungs, the patient's blood is pretty much completely saturated with oxygen, as much as it can carry. End-tidal carbon dioxide here is 42. The normal number is about 40, 42. So that's what you expect to see in a patient who is breathing regularly. That would be the end-tidal carbon dioxide for any of you. In fact, for those of you sitting here, that's about what you would see right now for yourself. That's about what you would see right now for yourself. Most of you would have a heart rate that is probably closer to 70 to 80. Please continue. You check the infusion pump. Please stop. You check the infusion pump because the patient's life depends on the infusion pump giving the amount of drug you specify.